see. Bob Schultz just came on, and Dave Pella, and Emily. That's not online. The agenda for this special meeting that has been called of the Grant County Health Board, we're actually looking at old business, but before we move into any business, we're going to do the minutes first, and then we're going to have Ruth Bender, I believe, talk to us in a few moments. So the minutes, we have minutes that have been submitted to us from June 15th and the June 22nd. So please review the June 15th. And for those who are online, you want to just all say your names who's here.
Yeah, Dr. Jeff Bragg.
Dr. Bragg.
Dr. Chad Leidy.
Leidy. Barbara Erke.
Chuck Bowling.
Chuck Bowling.
Dr. Phil Renfro.
Okay. And Dr. Moore is here, and legal counsel is here. So that's who is here. We see some names up there. We wanted to let you know who was in the meeting. Okay, so June 15th minutes. We would like to review them and have them approved. Typically, we wait till the next regular one, but we're having 2 more meetings, and so we thought we should do it now. So with several reports. New business will be for policy for staff attendance at health board meetings. That will be talked about later at the next meeting. And then the animal rights protocol was the old business, and that will come on in our next meeting as well. So
I would make a motion to approve the June 15th minutes. Second.
Any discussion on the minutes from the 15th? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Abstentions. So that passes. The next minutes will be June 22nd. That was another a special meeting called at 6 p.m. That was about for the COVID testing. So minutes, you see the people who have spoken, you see the levels that were proposed, and then actually on page 2 of the minute, it talks about the levels that were motioned and passed for level 1, level 2, and level 3. Level 4 was dropped. The 2 were mandates, and 1 was a recommendation. Level 1 and level 2 were mandates, and level 3 was a recommendation. This legal counsel. So, any?
I'll make a motion to approve.
Okay.
Second.
Okay. Any discussion on those minutes? All in favor, say aye.
Aye.
Opposed, same sign. Abstentions, same sign. So those have passed as well. So we're caught up on our minutes. And now, Mr. Bender, if you would come and, I think you handed us out a paper of deliverables. There's page 9 and 10 of some documents.
That basically, first of all, let me introduce myself to everybody. I think I know most everybody in here. My name is Bruce Bender, retired from the City of Marion Police Department, 25 years served as a police officer with the Army and with Marion Police Department. Also had retired as the EMA director for here after 15 years. So real quick, like my expertise is not in opposite medicine. I would never question it. The only thing I can do really is CPR class and first aid for my judo kids. All right. But my expertise comes from, or my training has come from logistics and the NIMS, National Incident Management Systems organizational structure, where I put in an organizational structure, I put in there how things are handled during a disaster. That's where my expertise comes from, or my training comes from. Also, with the health department, I will be the liaison with Emergency Management Director Bob Jackson. And also, I'm going to be here to assist Dr. Moore of whatever else he needs in the way of any kind of updates, training, or whatever it has to do with that. Now, one thing I do want to introduce you to, most of you may have seen before, this is the Grant County Plan. Maybe I know you've seen this before, okay? This is adopted by every agency in Grant County. You're more likely to take a look at it. What the county does, it gives you authority to do what you're doing through federal law, through state law, and ordinance, okay? You're more welcome to have a copy of this. It's based on 15 emergency support functions, and you are what they call emergency support function number 8. Now, I'll be glad to go into more detail with you at some other time if you wish. But this gives you authority to do what our community has done to take care of our community. What I gave you there, that sheet of paper is just kind of like the cliff notes of the job description for the job. So I mean, on top of that, now with the COVID-19 hitting us, again, I will be assisting Dr. Moore in whatever else he needs. Are there any questions for me right now?
One question is, where is there public access to that document?
No, there's not. But you're not allowed to have this because you're on the board. There are some, reason for there is because there's also annexes on here that have to do with security issues. Thank you, folks.
So I have
Yes,
one
ma'am.
question. I am not at all familiar with many of these initials that are on here. So maybe sometime you could create a cheat sheet so that when I read this, I actually know what I'm reading about.
Absolutely.
Okay,
Sure.
thank you.
I will do that.
Yeah.
FEMA,
Thank you. I'm just glad to have Bruce here to guide us. Kind of first year, we kind of stumbled our way through it, but nothing happened. And in the second year, God blessed us with the pandemic. So Bruce's expertise and guidance, along with Bob, with all of the other people, but as we go forward, hopefully be more informed and build institutional knowledge within the health department of what's the process, the National Incident Management System. What's our process for us dealing with disasters and emergencies that come up in the community as a health department and as a county government.
I do know what FEMA is. I was going to tell you that. I do know what FEMA is.
That's a start.
Yeah, that's a start.
Thank you, folks.
So the business at hand is the public health, the 2 mandates and the recommendation. And I would like to hear an explanation why we need to do this. I mean, so that the board knows what we're doing.
So we had a mandate, we had 2 mandates and a recommendation passed last meeting pending legal opinion for how do we as a health department relate to the schools reopening. That came about because the state had said, you local health departments come up with rules and guidelines for doing that. And in my opinion, gave the health department very little guidance. So we went and evaluated that, and we were one of 92 counties who were faced with that challenge. I looked at what was there, presented it to the board, and then the board voted on what did we think was the best one. Since that time, there has, and David can share this with us, in the sense that legal counsel says that in the absence of an emergency, and we're rolling back on those sort of things, that in the absence of an emergency, and the preparedness and other things, that the health department does not have the authority to make these mandatory. And so consistent with our talk after the meeting, that if legal counsel would get anything to say that we don't have the legal authority to make it mandatory, that we make it a strong recommendation. And David felt that, I believe, and I don't want to speak too much for him, but David felt that since the board had voted that to make it a recommendation, that we really need to meet and move it to a strong recommendation for that. Several things have happened since the time of that meeting. One of them is that I had a chance to meet with 5 of our 7 superintendents to smaller schools. There's 3 smaller schools, St. Paul, Lakeview Christian, and King's Academy. I did not meet with, but the others that we did meet with, and they after a lively discussion with led by this wonderful gentleman right here, Mr. McKenzie, but an informative one, that logistically they just, whatever they might think about it, that given all of the things that they had to do, that logistically it was difficult to do it, and how it would be to implement it. Logistically, it would be bad. Since that time, the state health department has come out and given us guidelines, and they still end up with the bottom of the thing, and your local health department will decide, but they've said, these are the things that we want you to do in order to do it. Since that time, the CDC has come out with a statement that says that we do not we do not support testing for asymptomatic people. We support testing for symptomatic people, but not asymptomatic people. So that the CDC has said that. So that we now have the things that the state health department says, this is what we want local health departments to do. And it doesn't include testing. It includes the things that they had talked to the superintendents about, but had not given us since then. I've had a chance to talk with Dr. Lindsay Weaver, who is under Dr. Bob's at the State Health Department, and that unless there's something that I vehemently disagree with, that I think is medically inappropriate, I will follow the State Health Department's lead and what they recommend for us to do. And there may be some local individual adaptations that we make for our county, but in the absence of that their lead said, this is what we want to do. So all of those things that I think that I would support, that we say, we still think this is sound. People should be tested, that you should know what's going on around you and other sorts of things, but that we would recommend that and not move it to a requirement. And if it's okay with you, Dr. I would look forward to David.
Certainly.
So I was made aware of the situation. I thought when you guys last met, we were just going to have a discussion. I didn't realize it was gather information from the schools. I didn't realize any action was going to be taken. My grandson was playing baseball, so I didn't realize it was imperative that I was here. So I apologize for not being here for that meeting. After that meeting, I talked to Dr. Moore, talked to Tara. They kind of filled me in on what was going on. So I did some legal research on this particular issue and what our rights are as a board and what Dr. Moore's rights are. I also contacted Kyle Persinger, who's the attorney for the commissioners, and he and I reached the exact same conclusion after doing the research. Under the facts as they sit now, normally when you want to do something and you're going to impinge on someone's liberties or freedom, they have to have an opportunity to be heard in court. There are exceptions, exigent circumstances. For example, let's say a school had 200 people all of a sudden get sick, which we don't have that right now. Then we can be in a position where we can do something. But under the statutes, the health board does have, the health officer has the power to close a school if he believes it's necessary. So, but that's really not what we're talking about. We're talking about testing. As Dr. Moore pointed out earlier, when you read this, you're under a state of an emergency, and I think that's ending shortly. So the powers that come from that are going to end on that date. So we refer back to what our state statute says. And our state statute basically says, unless we can show it's an emergency, we can't do this. We also have to be able to give people the right to be heard in court. So, for example, let's say a child, parents don't want him to be tested. They don't think it's necessary. The school says, too bad, you don't do that. Well, we can't really do that without giving them an opportunity to go and be heard in court. So that also opens up, although I don't even think we would win in court, as things sit right now, obviously, if we have 300 people in the school, they'll all have it, then that's probably a different story. But as it sits right now, I don't even think we can win. But we have to provide that opportunity unless an emergency exists. As it sits right now, I don't think we can get to that level to do that. So with all that said, I reached the conclusion that what we should do legally is the board, Dr. Moore, issues recommendations, which is partly what we did, take those two mandates to them and make them strong suggestions to the schools as what to do. As I said earlier, Mr. Persinger, he reached the exact same conclusion I did after researching the same statutes that I did.
And in light of that, also what I said is that now the CDC has stated that they do not recommend testing asymptomatic people. They don't recommend a broad spectrum testing. They have declared that the funds that are there for Optum are not for broad spectrum testing. Before, it was anybody who wants to test to get a test. They made testing available to companies or businesses that were sent there. The Optum has stated that, the CDC, the State Health Department has said that through Optum it can't be done. The CDC has come up with a different statement. So I think that in light of what has come and the guidance that they get, it might have been delayed guidance, but it's still right now we have that guidance I think that we should say that testing is helpful, but I don't think that we can even now say that we recommend that all of the teachers be tested, all of the personnel be tested based on what Dr. Weaver told me today, nor can we say that all athletes, if they're just because they're going to be in high risk exposure, should be tested and expect that to be covered by the Optum that is there. So the landscape has changed radically in the 9 days since we passed. The landscape that I've seen has changed radically. I had reached out to David Hopper, who is the local liaison, and he now suggested that I bypass him and go directly to Dr. Weaver with that question, because last week there was just no guidance available to us in terms of what do we do and how do we do this. And they're now suggesting, again, like I said, repeat myself, that they're not saying to 92 doctors, you figure out what you're going to tell your schools to do. This is what we want to tell you to do. And then if you have hardcore reasons to do otherwise, then as a local health department and as a home rule county, you have the right to do that. But we're not going to pay for it.
I have a couple of questions. Good to directed toward you. First of all, a comment to everyone and for the public. I think that this plan was made in good faith and an effort to try to control, address problems before they arise. So I commend Dr. Moore for his efforts to be proactive in this particular area. And my question to Mr. Goodfield is, I know that the county health officer has certain arbitrary authorities in light of emergencies you made reference to. Now, are there any specific guidelines? You know, you mentioned if 300 students get sick, he can close a school. What about if there's 150, if there's 100, if there's 10? I mean, are there any guidelines, or what role does his judgment come into this in terms of intervening in what he perceives as a public health emergency?
Well, first starting with the premise that the public health emergency declared by the state of Indiana will be ended and will not be back in place for the whole state. Start with the premise that that's not there. We then have to go to what the statutes provide as far as his responsibilities and his duties go. There is no clear line rule as far as what he can do and not do as far as numbers go. It's going to be a determination that he is going to have to make whether he believes it's an emergency or not. Really, the statute does provide for court to get in that authority if he believes that exists. I'm assuming if we get to that point, he'll probably,
Are you guys?
either the two of us will discuss and we'll see if necessary. I'm assuming school, get their take on all that. He does have that ability, and I'm sure that's a power that he would wield if he felt it's necessary, but certainly administered properly. But as far as any rule, there is nothing in statute which guides us.
Then I guess the third thing is, in light of this new information, because I have not seen this recommendation from the CDC, but I believe you, it brings up a very valid question. Can we recommend any testing for asymptomatic people at all as part of this initial proposal that the CDC has approved?
So,
I'm just talking about, you know,
a fairly specific statement. Dr. Weaver texted me the statement from the CDC, and if you give me a second, I can express that for you.
While you're looking at that, one other question, and then I'll be quiet, is I had a circumstance arise at Indiana Western University yesterday that caused me to express involving a student where we were concerned about the possibility of COVID-19. We ran into some problems in terms of finding where we could arrange testing for this. Do you have some guidance for us for the health board and for the county, since this is a public meeting, on where people should go for testing if they are concerned about the possibility of COVID-19?
So that we have two sides, and the landscape again is changing. When the Optum, the source contracted with the state, was first envisioned, it was just a step down from what the hospital was doing in terms of the rigid requirements. And they announced, and Holcomb announced also in one of his that anybody who wanted to be tested in Indiana could be tested. That has now shifted based on what we have here, that you either have to be symptomatic or have had close contact 6 feet, 15 minutes with somebody known to be positive. So that at this point, then that liberal testing that we had that was alive a week ago is not alive this week. We have an intern. The health department is manning an internship program for college students, and with Bruce and Bob Jackson and Wayne, who has testing sites available, and these are open to the general public. And I would envision under these new guidelines that we have that we won't be able to continue that beyond this time. But you want me to forward this to you to read?
That would be, well, yes.
Okay.
I'd like this.
So this is updates on screening COVID-19 tests.
Just a moment, please. Mr. McKenzie, could you mute your speaker, please? Thank you. Thank you.
CDC testing for screening in schools. Universal SARS-CoV testing for all students and staff in school settings has not been systematically studied. It is not known if testing in school settings provide any additional reduction in person-to-person transmission of the virus beyond what would be expected with implementation of either infection prevention measures such as social distancing, cloth face coverings, hand washing, enhanced cleaning and disinfection. Therefore, CDC does not recommend universal testing of all students and staff. Implementation of a universal approach to testing in schools may pose challenges such as the lack of infrastructure to support routine testing and follow-up in the school setting, unknown acceptability of this testing approach among students, parents, and staff, lack of dedicated resources practical considerations related to testing minors and potential disruption in the educational environment. And then it gives a reference for that. Additionally, CMS, that's the provision that initially had that Medicare would cover the cost of these testings, which was initially one of the things that we were operating under. Testing for surveillance or employment purposes are not required to be covered. Clinical decisions for testing are made by the attending health care provider and may include individuals with signs or symptoms of COVID-19, as well as individuals without symptoms who are known or suspected of recent exposure. Screening for workplace health and safety, that is, return to work, for public health surveillance or other purposes not primary for individualized diagnosis and treatment, is interpreted as beyond the scope of the multiple initials in the CARES Act. So this is something that is, and obviously, if this has come down in the course of a week, so I suspect that we were not the only health department that has raised these issues, because now they're all up and down the ladder. They've come down with what would have been very helpful in the beginning. That is, what do we want you local health departments to do? And I imagine that lots of people have had that, but everything is much more rigidly limited, and things that we were told before from the updates that we get from the health department are now being greatly narrowed by the current recommendation.
I mean, there was no studies for schools, but then again, there were no studies for long-term care either.
Yeah.
We saw what happened in long-term care. So to say that I hope that we don't get in the same situation.
And
You wanted to say something?
No, I was going to make a motion.
Okay.
In light of this information, I'll make a motion that we send level 1 and level 2 mandates and also level 3 recommendations.
I second it.
So we're rescinding them all?
We're sending them all because nobody's gonna pay for it. What I'm reading there is nobody's gonna pay for it from screening.
Okay.
And unless somebody is sick, this is the way I interpret it, unless somebody's sick, that's the only testing that anybody's gonna pay for. So I don't think as a policy, we can even recommend testing to anybody if nobody's gonna pay for it. And then we wait and see. That's why I asked the earlier question, if we start ending up with a lot of sick people showing up at our schools, then we're going to have to be prepared to act at that point. Yes.
Okay, so we have a motion and a second to rescind level 1, level 2, and level 3. Any other comments or questions or from anybody?
I guess I just want to say that I agree with the comment that the idea of the recommendations at the time that they were made were consistent with what was happening. And they did encourage testing, but even as of 2 days ago in Grant County, you were able to go get a test without any symptoms. This is brand new recommendations. And I totally agree with the motion in the second that we have to make the changes. But the idea and the motions and the recommendations and mandates that were discussed at the last meeting fit consistently with the information we had at that point. So I just wanted to agree and add that comment.
And while there are things that I disagree with, we all have to get in a boat and we all need to row in the same direction. And unless, I think that this is the first time that our state health officials have dealt with the pandemic. And I think that they are playing catch up with it too, and they're differing opinions. And I thank you very much for that, right? And I'm a big boy, and I volunteer for this position. And it would be nice if they told me in advance, told us in advance what we're doing, but we all are finding and figuring our way through this. And I think given where they are right now, I can support what Dr. Lighting said.
I have one comment too.
Yeah.
To Dr. Moore's credit, right? He and I talked almost right after He wanted to make sure legally that the issue was being addressed. We weren't overstepping our bounds. So he did. We talked almost immediately. I told him I'd get back with him the next day. And then I shared with him what our research was. He immediately knew that, and I think that's why we got this meeting. So it's fixed. And a second comment, which I didn't get into earlier, that any time we go and we mandate, we also potentially open ourselves up to liability as a county. That's what I'm always really cautious about. For example, a child says, no, I'm not paying that. The school says, well, the county said you had to do it. So we end up in court on that, which of course costs fees, on and on and on. So although it's not probably a major concern, but it is always a concern, which is in the back of my mind whenever we're stepping outside statutory rules.
Call for the vote?
I'll call for the vote. All in favor of rescinding level 1, level 2, and level 3, say aye.
Aye.
Opposed, same sign. Abstention, same sign. That has passed.
If I may, one of the reasons I think we were trying to get the testing done is almost a way of screening. And I know some other information came through with the Department of Education and the State Board of Health and everything. And I'm kind of curious on if maybe some of the individuals representing the schools could tell us what you're training on screening, because obviously it's not possible to do temperature checks of everybody coming into the building. But it talks about self-screening and it talks about training students and parents on screening. Do you have what are your plans in that particular area? Because honestly, yeah, Susan, if you don't mind answering that.
At this point, there's a
You can
couple
come up a little closer to the mic, please.
And introduce yourself to the audience there also.
I'm Sue Nicholson, and I'm the school nurse for one of the school nurses. And I've worked with some of the other nurses in the county on this. The state says they're going to come out with a guideline, like either a PowerPoint or a webinar for everybody to hear the same, which is my hope. And tomorrow there's a meeting at 10 o'clock with Dr. McCormick and some of the medical people for the nurses, and hoping to get more information. That being said, we also found a PowerPoint that would be good for the kids. So there's plans that send stuff home, as well as do something with the kids in the classroom, and as well as all staff before school starts be in service. And that's kind of what I'm hoping the state tomorrow will give us information.
So my other concern is not just the screening and trying to teach people how to realize if you're sick, your child's sick, they need to stay home and those kind of things, especially the COVID symptoms. But we touched this before on the mask wearing situation, and I saw how many times I read should, and I know it doesn't say mandate, we're not looking at that, but it says, there's a lot of feasible words in there, but very strong should from the CDC as far as when you're talking about teachers and staff, employees wearing masks, and students, especially the older students wearing masks. Are you all still very strongly pushing that, or how does that really go with your students and your staff? Or maybe I should ask Mr. McKenzie, because he's really the superintendent, or one of the other superintendents that may be on. I don't know you all by see Tab at least out there.
Hello. Our wording will be that we will recommend mask, and we have already purchased a mask with a Mississinawa emblem on it for every employee in the district, and we are in the process of securing a mask for every student in the district. we're not going to mandate it at this point, and I'm not aware of any public school in Grant County that intends to mandate at this point. But as everybody knows, things are changing nationally, and in my mind, I'm wanting Mrs. Senewal to be prepared for the very real possibility that it could be mandated sometime in the future during this coming school year. And we want to be ready for that possibility.
That's pretty much what I wanted to hear, so I appreciate that.
Thank you.
Because last time we met, I know it was, we discussed it a bit, but nothing ever really was a solid concrete recommendation or floated around. So I appreciate that, Chad.
And just a little bit to speaking of that, teaching students and non-medical people to recognize the signs and symptoms of COVID, and 40% plus in the state survey had 0 symptoms. So that you're going to do, if you catch them sick and coughing or spitting or doing all of that stuff, you're only going to catch a little bit more than half of the people who are coming into the population who are there. And it is the real life reality is that in our political environment, you're not going to be able to force people to do things. From a medical health point of view, like we did with the smoking thing, from the health point of view, that not knowing what the status is in your school leaves just lots of opportunities for things to go on. And we live in a real life world, and we can say what we think is medically appropriate, and then we have to exercise. And how do we actualize that? And when I had a chance to talk with Dr. McKenzie, the other superintendents, they expressed that they personally do believe in all of this, but the political reality, the logistic reality of trying to bring it about in a school year when things are changing and when the public has its point of view, they've got enough challenges on the plate that they don't see how they can make that happen. And like I said before, they were very instructional and very supportive, and as he did that night, Dr. McKenzie was one of the ones that led that, and I appreciate that.
Okay, thank you. Anything else to come before this? I'd entertain a motion.
Second.
Okay.
Thank you all for coming. Thank you for
All in
coming.
favor, say aye.
Aye.
Hopefully we won't have this again this year. Sorry, guys. Marcus, thank you.
No problem, Doc.
I didn't see it.
Okay. There was an